Yes, you can start now. Hello and welcome to Seven Sentinels. This is Grand Master Class, and I'm Peter Simon with you. Today we are conducting a speaking session, and we have with us Elizabeth Ahenowa from Ghana originally, but currently is in the United Kingdom, London. Yes, you can start now.
Hiya, good morning.
Good morning, nurse.
My name is Nurse Elizabeth Senior. You're welcome to the hospital. Can you confirm to me your name?
My name is Lincoln. You can call me Mr. Lincoln.
Hi, Mr. Lincoln. I understand you've been previously diagnosed with squamous cell carcinoma, and you've had surgery done on that, and you're here to remove your stitches. Am I correct?
Yes, you're absolutely right, nurse. I had a lesion removed from my hand following a diagnosis of squamous cell carcinoma. And I don't exactly know what is this squamous cell carcinoma. I think it's
Oh,
another form of cancer. What do you say, nurse? Is that right?
yeah. Yeah. Is very true. Um, but can you please tell me, after your surgery, do you have any concern? Have you encountered any problem?
Yeah, I don't know anything. Can you please explain me everything, nurse, about this? I'm a little bit scared and concerned. I'm worried about what happens to my life.
Okay, so um, when we say squamous cell carcinoma, it's a type of cancer cell. Cells, when we talk about cancer, we mean um, let me put it this way, an type of abnormal cell growth that your body actually, I mean, grows when exposed to something abnormal. So this type of cell, cancer cell, happens when your body is exposed to sun, most especially, or what we call ultraviolet radiation. Do you understand?
Yes, nurse, I understand what squamous cell carcinoma is now, but I want to know
Okay.
if I am likely to need more surgery to remove other lesions in the
Um,
future.
the surgery that was done on you previously, um, I can tell you is the best thing that the doctors, did on you, and it will help you remove the lesions and also prevent the cancer cells from spreading to other parts of your body. And it is very important that going to the house, you need to take note of your body. You should keep monitoring your body. You should keep on checking your body for any unusual thing, any changes in your skin, maybe spots. And also you should do a regular checkup with the doctors. Is that helpful?
Yeah, of course, nurse, definitely. That's very fine. Tell me what more I need to do.
Okay. So, um, going to the house, I think that something that will be beneficial to you is always using a sunscreen on your body. Apply sunscreen whenever you are exposed to the sun. And also, you should always put on hats. Hats. Yeah. So, it is very important that you should continue to cover your body and to prevent further damage to your skin. Is that helpful?
Yeah, nurse, I always wear a high factor sunscreen, 30 or higher. I wear a hat when I'm out in the sun, but I think it's too late because the damage has already been done. I
Okay.
spent too much of my youth in the sun, so therefore that might be the cause, that might be the reason for my fate today.
So that's where the sunscreen comes in. You should always protect your skin with the sunscreen whenever you go out. But tell me, um, have you after the surgery, have you feeling any pain? Does the I mean the wound? Any, have you seen any discharge coming out of the wound?
Yeah, nurse. First thing is regarding my care. I'll definitely look after my skin from now onwards so very carefully.
Oh,
And regarding
okay,
the
that's fine.
discharge and the pain, yeah, the wound has been fine. There's no
Oh,
pain,
that's
no
great.
discharge.
Yeah,
And I think,
yeah.
but the thing is, I think it's too early to have the stitches out. Why can't I wait for another week or 10 days before I remove the stitches?
Oh, no. You should always have your stitches removed within 7 to 14 days after every surgery. It will help in with the wound healing, and it is very important it gets assessed by the doctor whether to know that we're even to know that the wound is really healing or not, so that they'll take it from there. Is that helpful? And
Yeah,
I would advise that
of course.
when going home, you should always keep your wound clean, covered, and dry as well.
Yeah,
Will that
I'll
help?
follow your suggestions, nurse. Definitely, I'll follow. And
So,
okay, now I'm ready to have the stitches removed.
okay, all right. So I just want to go back to what I said earlier, that the surgery done on you is the best thing the doctors could ever do on you. It will help you remove bleeding and also prevent the cancer from coming back and spreading to other parts of your body. It is also important that you keep your wound clean, um, dry. Whenever you are exposed to the sun, you need to apply sunscreen on your body and also wear a hat. I will advise that you should always keep your skin under monitoring. You should always check to see any unusual thing and also report to the doctor when necessary. So if I have your consent now, then I'll just go get my things, then I'll come back to remove your stitches for you.
Yeah, thank you very
All right.
much, nurse.
Thank you very much.
Yeah. So now coming to the feedback part. Yes. So there is some sort of hesitation in the beginning stages. Try to overcome that hesitation because you have to come out of that fear factor. Maybe this is the first session for you, but whatever it is, you have a lot of experience as a nurse and you have treated number of patients and you have participated in number of consultations. This is not the first of its kind for you. This is not the first time you are doing some speaking. But the thing is, maybe you might have done in your own language, but that's different thing. But whatever you are speaking, you have to speak in English. That's the only difference. Otherwise, you have the experience, you have the subject, you have the knowledge, and you have everything. So no need to worry about anything. Just think that the other person who is in front of you is a patient and you are the superior. You are the information provider and he is the information recipient. So you are on the upper hand and he is on the lower hand. So you are giving and he is taking. That means you are giving suggestions, he is taking. You are giving reassurance, he is taking. So everything you are providing. So that's it. Only his background he will give, his problems he will tell. Otherwise, you are everything. However, you are the boss. Remember that. Don't think that the other person is a teacher and you are a student. Don't think that the other person is an examiner and you are a candidate. Both these angles are wrong notions. Think that you are a nurse and the other person is a patient. That makes you strong. If you think that you are a student and I am a teacher, it makes you weak because teacher is stronger than the student. So you will automatically become weak. And next, if you think that you are an examinee and I am an examiner, or you are a candidate and I am an examiner, there also you are weak because examiner is stronger and your candidate becomes weak. So you have the power which is vested in your hands. You are the nurse and I am the patient. So you are stronger. So where is the need for you to panic? Where is the need for you to worry? So there is no need at all. Whatever you speak, he will listen because he does not know anything. You are the authority over the subject. You know everything. He doesn't know anything. You are the provider. He is the receiver. You are in confidence and he has tension and worry. You are cool and relaxed, but he is upset. You know what happens to his future, so you are fine, but he doesn't know anything about his future, so he is, you know, doubtful, panic. So be stronger, be cool, be comfortable. Yeah. Is that clear, Elizabeth? Was the suggestion beneficial for you?
Yeah, it's very helpful. Yeah,
Yeah.
yeah.
So I will
I
take
think that I think that um because I think being exposed to something new, sometimes you get frightened.
Mhm.
You think that maybe what if you're
Yes,
about to say is wrong? Yeah, I think that's the problem now.
yes.
I think it's
And
very
you can
helpful.
also use some sentences like this: no brooding over spilt milk. That means past is past, so why should you worry? You could have
Yeah,
told. When I told, when I was in my youth, I wasted and spoiled my chances. My health is damaged, and I got skin cancer. I was exposed to the sun. So now you can use the word saying that no brooding over spilt milk. That means don't worry about the past. This is an idiom. So you can use idioms like this: no brooding over spilt milk, or don't brood over spilt milk. Means milk is spilt, finished, it lost forever. So no need to worry about that. So think about the present, bother about the present. There is much more to do in the future. Whatever happened is happened. Now protect your future by taking necessary precautions now. Otherwise, the conditions will deteriorate and the situation will go out of your hands, and there is a stage of no return, and you will face serious complications, and nobody can help you in the later stages. So prevention is better than cure. See the way how I am talking. Are you talking like this very powerfully? No. So try to improve your quality. I have this recorded. You can take these notes afterwards. Okay, I'll give you the printout. No problem. I'll send you the typed version, and I'll tell you my words also, everything you can write down, and then I'll give you the link. You can watch the video. You can see how you have performed, and how I spoke, what suggestions I gave. Make notes of all these suggestions watching the video later, and this will help you every day. I'll give you every day two or three cards. You practice one with each. You have your three members now. You can practice, and one with me you can practice. In pairs, you can practice one each. And now, afterwards, when you come, I'll record your and I'll give you feedback. You can just practice together with one another. But when you come to me, I'll give you feedback. Right. Do you have any questions, Elizabeth, to ask me?
no, thank you. I'm
Yeah.
very fine.
Are you happy with the feedback?
Yeah, I'm very happy. I'm
I
very happy.
think you are getting more than what you paid for, correct? The quality,
Yeah,
I mean.
yeah, yeah.
Yeah. Work
Thank you.
hard and get good name for me.
All
Right.
right, I will.
Next, we have
Thank
with
you.
us Matilda. Hello, Matilda.
Hello.
Yeah, are you fine, Matilda?
Yes, I'm good.
You're waiting, you're waiting. What's this happening? What is this, sir, attacking like this? So many corrections. So, Yeah, that's fine. That's fine. You need it. You need it. Okay.
Okay.
Yeah. So we are going to do the session next. Have you prepared already, or do you need some time to prepare?
I need some time to.
Yeah, you have some time. I'm giving you 3 minutes maximum. You can prepare.